what are some of the effective communication strategies to, you know, get this information and share this information with you about pharmacist provided naltrexone injections?
I would just say like an email to our clinic manager to forward out to providers.
Okay. All right.
Communication with SAM, the Wisconsin chapter of Society of Addiction Medicine. Their board could definitely help with passing it along to the rest of the state's providers, or Dane County providers.
Okay.
And then I guess along with that, sort of the Wisconsin Medical Society and WPA, Wisconsin Psychiatric, too. They can definitely, communicating with their board help get the word out too.
Okay. One of the things that we were, thinking about that we'd put together, is probably a brief, one-page flyer that would kind of describe, the service and talk about, what the pharmacies are doing or the benefits of getting this service at the pharmacy. Would that be sufficient kind of type of communication messaging to send out, or, how do we, I guess the question I have is kind of how do we package that in a way that, a very busy provider is going to maybe take a moment to, read and learn about that? Is this one-page flyer sufficient? Does it need to be something else?
I think a one-page flyer is fine as long as there's an easy way to access more information and more detail, because obviously there's going to be a lot of pieces that go in to actually putting in the order and making sure that, everything gets checked with insurance coverage. So as long as there's like an actual person's phone number where you're not on hold for a million years, or a website with detailed information so that providers that are interested can get that information readily, I think would be helpful.
Okay.
But it doesn't need to be like the full, 5-page document about how to order Vivitrol at the pharmacy as the advertising piece.
Yes.
And how they have like the market on like the low dose naltrexone, and they, just really, again, they have like the worksheet that they send you. They have informational nights that you can go and like talk to the pharmacy. They're always just so open if you call them. So they are a good role model for that.
Okay. Other thoughts about communication approaches or strategies?
Honestly, I imagine if patients know, they'll come and ask us.
Okay.
So making sure that patients know. And in particular, places that patients are. So like in treatment facilities, psychosocial support groups like NA, Smart Recovery, places where they would get that information and then can let their provider know. I think would be helpful.
I know that they have the WellPath program where they get their first injection, but I think a lot of people have difficulty getting that second injection.
Okay.
Yeah, other like county drug courts, AODA counselors through county human services is who we work with a lot.
We do have, monthly meetings. And I do think that could be a venue where you could speak about this program for 5 or 10 minutes. People do that. However, it's probably a little more complicated than you think. Like getting,
getting the spec. Yeah.
To get to be able to do this.
Right.
But I can help connect you with like people who would be involved with that if you're interested in trying to like make links with.
That's why it's so interesting to hear the variability across clinics, because like I said, some previous focus group participants were really saying this would be an easy way to do it and an easy way to make an impact on everyone in the clinic. But as you just alluded to, sometimes it's not easy to gain entrance into that forum. So I'm glad to hear that isn't as easily accomplished in certain realms. Thank you.
But you can do things on the down low, like if you wanted to on your own, but then, it's really different than to come and
Yes.
like kind of, yeah.
As a presenter, yes.
I think just the other thing to say is it depends who you're trying to target. So if you're looking for little tiny solo practitioners who might not otherwise be able to manage doing Vivitrol in their own clinic, but would find it a lot easier to send someone to the pharmacy, those aren't the people that are having grand rounds that would be hearing that visit. And then for
Absolutely.
us, we're not academic, right? So we're just in it all day long clinically. So it would be hard to ask people to step aside and go to a presentation unless it was going to be really high yield. Like we knew a lot of our patients were going to benefit from it. It was easily accessible to our patients. Otherwise, I think that would be a hard sell.
So there's not a monthly or bi-monthly forum in which clinicians get together, have the opportunity to get together as a group?
Yeah, I mean, we do have a staff meeting, like a provider staff meeting that we do every kind of 1 to 2 months. It's just it's a pretty full agenda, but certainly we could have a guest at that.
Okay,